Hello, my name is Almas Sharman. I'm professor of medicine, and I'm host of this program entitled Diamond Tips. It's mostly about health and wellness. And obviously, because of this extraordinary situation, most of our programs dedicated to COVID-19, to coronavirus pandemic. Today, our host is Dr. Daniel Singer. He is currently the regional director for Central Asia office at the U.S. Centers for Disease Control and Prevention, CDC. He is an internal medicine physician with experience in global health and health policy. During his extensive career, Dr. Singer held distinguished federal positions focusing on global health and integration of science and policy. He worked for several years in CDC headquarters in Atlanta and international offices in Malawi and Mozambique. Currently, he lives in Almaty, Kazakhstan. He was also involved in research programs at the National Institute of Health and served as a senior medical policy advisor in the U.S. Department of State's Office of International Health and Biodefense. Dr. Singer received his bachelor degree from the University of Pennsylvania and his medical degree from the University of Pittsburgh. He completed his Master of Public Health program at Johns Hopkins University, and I'm pleased to learn that because back in 1990s, I used to work at Johns Hopkins University, Department of International Health with Dr. Robert Black and colleagues. And also my wife, Johns Hopkins is my wife's alma mater, so it's our beloved university, and I'm very pleased that you also have a strong connection with Johns Hopkins in your background. So Dr. Singer, as you may know, the situation with the coronavirus epidemic has worsened in Kazakhstan during the last couple of weeks. There is discussion about the second wave, as well as what some people call Italian, Spanish, or even New York scenario. Since July 5th, just a few days ago, quarantine measures have been reinforced in Kazakhstan. Obviously, a more stringent lockdown, perhaps for a shorter period of time, may lead to relief in both public health side as well as economic side. This is like aggressive treatment of patient. So do you think the lockdown in Kazakhstan is stringent enough in current situation? What would you advise the new health minister of Kazakhstan as for how long should restrictive measures be maintained?
I think it's the right thing to do at this time, having seen the rise in cases across the country through the month of June. I think it's a necessary step. The quarantine, the lockdown that is planned for now, it needs to be rigorously enforced. And the minister and the country need to be aware that the benefit of this lockdown will not be evident for probably 3 to 4 weeks. It takes some time after you implement the lockdown to see its impact on the numbers of cases and on the numbers of patients in the hospital. So I think it really does need to be enforced for about that period. And after that time, then there's an opportunity to reassess and see how it's working and whether it's been properly implemented. I don't think that the country will be able to get ahead of this wave with a short quarantine. We've seen a mutation in the virus. It's a mutation that was first noticed in early March, but it's now become the dominant mutation of the virus, and it makes the virus much more transmissible. So the epidemic that we're dealing with now is a virus that's much easier to spread. And that needs to be considered in these quarantine plans. There's some research being done in other countries about what's called pulsed quarantine, where schools and businesses would all be closed for a period of about 2 weeks and then reopened for a period of about 2 weeks. This is something that might be considered in the future. It may be effective. Closing for a shorter period of time, closing stores and malls for a weekend, which is something that was done recently in Almaty and Nursultan, that's probably not effective because the incubation period of this virus is so much longer than that. So looking at this virus, which is more transmissible, possibly less lethal, but that's not as clear right now. I think a lockdown of several weeks is necessary, and based on our experience in other countries, that's when you'll be able to see the positive impact.
Yeah, so I understand that this 14 plus days period for lockdown is largely determined with incubation period and with the natural immune response to the virus. Is that correct?
Yeah, it depends on the incubation period. It depends on what's called the serial interval, which is the time it takes for one person to infect another person. It's the incubation period plus additional time for contact and such. So the models that we use have serial intervals of several days and incubation periods up to 14 days. It looks like you really need to get a few cycles of that in lockdown to really break the transmission.
You mentioned about mutation of the virus. So I assume that in the United States, the virus mostly came from the Italy, mostly talking about Wuhan virus and Italian strain of viruses. And you mentioned that the virus became more contagious, and also mentioned that it may become more weaker. So any thought on that? So what's your feeling that it's obviously it's evolution of virus. It must become weaker in order to survive. Are you observing something like that now?
There was a nice study that was published just a week or two ago showing a mutation in the spike protein, the little protein that extends off of the virus that it uses to attach to human cells. And it showed that mutation does increase the contagiousness, the transmissibility by about 9-fold, about 9 times more transmissible. That's very, very significant. That mutation did not exist in February, but it did appear in March. And it's become the widespread version of that virus. There's mutations constantly happening, and we're always looking at samples of viruses as they evolve from different parts of the world to see how it's spreading. You're right that it's common when a virus enters a human population for the first time that over a period of time it will become more transmissible but less lethal. That's sort of a natural way that the virus adapts to living in humans. I have not seen data so far that documents that it's less lethal. That's a possibility, and it's certainly a hope, but I think we need a little better information and a little more time to document that the virus in circulation now is truly less lethal than it has been. And of course, we hope that people have gained experience treating the disease and that we're able to do more to save patients than we were, say, 3 months ago.
There was just a report, I think yesterday, a few scientists approached the World Health Organization suggesting to revise their recommendations as far as how to protect from coronavirus. And the main point was that currently the virus mostly transmitted through air, droplets, through aerosols, as opposed to what everybody thought previously. It's mostly through large droplets. Is it the latest trends, or has it anything to do with virus mutation, or it's known from the beginning? Basically, if this main mode of transmission through aerosols, which means that people have to avoid congregating in closed spaces, less ventilated. So is it a breakthrough? Has it anything to do with the mutation of the virus, or it's just a known fact?
I'm aware that there was a letter that went to WHO arguing that the virus should be classified as spreading through aerosol routes. I haven't seen the data. I think personally, I appreciate the work of all the scientists, but as always in science, trust the data and examine their argument on a very impartial scientific basis before you agree or disagree. So I'm not in a position right now to have an opinion about it because I haven't examined the substance of their data or their argument. It's possible that the virus has mutated to transmit differently. It's possible that this is just a better understanding of the cases that we've been seeing all along. It's very, very hard when someone becomes sick to know exactly how they became sick. And there's a lot of both basic bench research as well as epidemiology that goes into trying to establish that. But there's a number of viruses in the world that we know transmit through aerosols, even viruses like measles, and there's others that don't. So, coronaviruses are primarily known to spread through respiratory droplets. This could be a different coronavirus. I really would want to spend some time with the data and look at the science before I knew for sure whether that was something that was likely.
Okay. So if you don't mind, we'll move to US experience and to see how it is applicable to Kazakhstan. In his recent testimony to Congress, US top infectious disease advisor, Dr. Anthony Fauci, elaborated as why Europe has largely succeeded, maybe several countries in Europe to be precise, and the US significantly failed to control the virus in several states. Just reports recently demonstrated that virus is spreading rapidly in southern states in the United States and Florida and several other parts of the United States. So what are the lessons you think learned from the experience in the US and Europe that are applicable to Kazakhstan?
I think there's a great number of lessons that we can be learned that we could learn from comparing the experiences in different areas. There's several countries in Europe that have had success. There's also other countries, places like Georgia or New Zealand, that have done very well in implementing lockdowns and controlling the virus. My sister, she lives in Spain, and during their lockdown, her child, who's 4 years old, was not allowed out of the apartment at all for 6 weeks. That's a very significant move. It's very stressful for families to not have children allowed outside, but that's what they did. And they persevered and they survived that process. And Spain did very well in being able to slow the transmission of the virus. In the United States, each of our 50 states is allowed to make its own policies, and they're directed by their own governor. They're not obligated to follow any recommendations from the national level. And because of that, we have our own sort of experiments that go on where different states implement different policies, and then we see what the consequences of those are. So it appears that in states where the governors, the leaders, took strong action, and where people did follow those rules and recommendations, they were able to suppress the virus. The state of Massachusetts, which is in the northeast of our country, they've done very well in reducing transmission, and it's also a very populous state. So there's certainly parts of our country that are struggling right now. It's heartbreaking to see the ongoing transmission there, and I think that we do need to look at both the policies that the leaders put in place, and also the willingness of the population to follow those policies as guides of what needs to be done.
Thank you. Speaking of children of Spain, just 2 days ago, I spoke to Dr. Antonio Santamera, who is currently in Madrid, Spain, and he told me exactly the same thing. He said that during the strict lockdown, the kids were also locked with their parents, and even now they are permitted to meet with their grandparents only outside in the parks and wearing the masks. But recently, the American Academy of Pediatrics came up with a very clear, although controversial from many point of view, statement, arguing that given what we know about coronavirus and about kids being stuck at home, strongly advocating that all policy consideration for the coming school year should start with the goal of having students physically present at school. And actually, this very much in line with what UNICEF director mentioned recently, because kids staying at home not only affect the academic performance, but also related to domestic violence, behavioral, psychological issues, and it's important to do something with that. And several countries, such as Denmark, Sweden, and many others, they decided actually to proceed and let children to go to school. Of course, assuming there will be certain measures taken to protect them from getting infected. So, do you think this recommendation of the American Academy of Pediatrics justified? And if yes, would you recommend the authorities, Kazakh government, to open schools in September?
Yeah, this is an incredibly difficult question that countries everywhere are struggling with. As you noted, it's hard because it's important, and it's also based on a lot of unknowns. Or, there's a lot of things you would like to know to help you make this decision, and that information is just not available yet. It is clear that the vast majority of children who get infected recover very well. Most children have no symptoms or mild symptoms, and they do okay. It also appears that children may spread the disease even when they're feeling well to other people, including older adults, although there's even debate right now about how common this is. It's clear that children benefit from both the educational instruction that they get in school, as well as the social and developmental benefits of being with other children. Being in school is good for children, and all of us need to weigh those benefits against the potential consequences of allowing the virus to continue to spread through the community. Children could survive a temporary disruption to their education. And this has happened in every major war where children have not been able to go to school for extended periods of time. They're resilient, and eventually they recover and move on. Whether that is needed right now, it depends on, as I said, some factors that we're not fully aware of. The virus is mutating, the virus is spreading very quickly. So there's a lot of uncertainty about what the situation will be like in September. My hope for Kazakhstan and countries in this region, if they do implement a strict lockdown now, and it's properly enforced, they will make progress. They will make good progress in July and August, and there will be much less transmission. And I think in that situation, it could be safe to open schools. But you'll need to see what happens in the next couple of months. And then if the schools are opened, there'll need to be continued vigilance. We'll need to monitor the situation because, as you're aware, with the onset of cold weather and children being back together, the situation could change again very quickly.
Okay, thank you. Really tough questions. I agree.
It's
a lot of responsibility to really suggest something like that.
Yeah.
Well, Dr. Singer, the US federal government and CDC in particular that you represent in Central Asia had led to all kinds of successful public health programs that have to do with HIV, safe sex, seatbelt policies, healthy eating. Why has it been so hard in this case to help people understand if we want to slow the spread of coronavirus epidemic? There are guidelines and we'll have to follow them. So why is it so difficult for people to follow them?
People struggle quite a bit with uncertainty. I think that's part of it. This is a new virus, and we have been learning as we go, important things like how do you get it? How does it spread? Who is most at risk? These are all things that we knew nothing about in January, and we're just starting to understand them. And I think the uncertainty around it causes people to doubt the recommendations. That's part of the problem. But difficulties around pandemics and infectious disease are not new. 100 years ago, during the 1918 influenza pandemic, there was a recommendation to wear masks. And there were, in the United States, community groups that organized to protest the mask requirement, just as there are community groups protesting the masks today. So I think that there's this sort of natural human instinct to not take advice if you don't have a personal belief or understanding of why it's important, and particularly when it's something that's disruptive to people's lives. These recommendations, like the recommendation to wear masks, you're asking people to take an action which we believe is really more to protect other people than it is to protect themselves. And people naturally tend to be confident of themselves and feel that they're not infected. They feel fine. They couldn't possibly be sick. So they feel like, well, this is somebody else's problem. It's not my problem. And that other people can do that, but I don't need to because I feel okay. That's not the guideline. The guideline is we should all be wearing masks because some of us are sick and don't know it. And I think that that's very difficult for a lot of people to do at this time where everything is uncertain, and it makes people very, very nervous to be asked to to follow rules like this.
Yeah, this mask thing, why so contentious? I still don't understand. What's a big deal? I understand the closing businesses or closing schools a big deal, but why masks? Why? May I ask you why President Trump refuses to wear a mask in public, as well as like and his core supporters follow him. This obviously he sets example.
Yeah, I'm here in Almaty with you. I'm not in a position to speculate on President Trump and his personal decision-making process. I think it's been difficult for a lot of people, as I said, to understand what it means to wear a mask. How effective is it? How important is it? It's something that people struggle with for all different reasons. I think honestly, I suspect there's some people who are claustrophobic, who just are get anxiety when they wear a mask because they believe that they're not getting fresh air, even though there's no evidence of that. So I think there's a lot of different factors that can affect people's individual decision making. But it's something that the science clearly indicates does help us to protect each other, and that's the message that we're trying to get out, is that wearing a mask when you're in public, wearing a mask when you're unable to maintain social distance is something that you're doing for your community. It's something that you're doing to protect the people who are around you.
Okay, so everybody knows that the United States is a vast and diverse country, and actually this can be clearly seen from the COVID-19 statistics, which is on the West Coast, especially in the Bay Area, much more favorable than in the other regions of the United States, such as we mentioned previously, southern states, Florida, Midwest. It is due to the fact that more conscious and more socially responsible citizens live in Silicon Valley, especially those who are involved in technology industries.
I'm not sure I would say it that way. I think it's generally dangerous to claim that one population is more conscious or socially responsible than another. And I imagine there's people who would argue that Silicon Valley is not a good example of social responsibility. I think the differences that you see in different parts of the country depend on people's actions. It depends on the policies that are in place and what people are doing individually and as groups to reduce transmissions. So it falls to the examples that are set by the community leaders, the policies that are put in place by the political leaders. Those matter, and in the United States, they do vary from one place to another. Another aspect, of course, is that people are more likely to follow the recommendations when they trust science and they trust scientists. So, you could make an argument that people in Silicon Valley are more oriented to science, perhaps, than other places. But I think that, generally speaking, in America, we have a strong history, strong cultural legacy of individualism. And recently, many parts of the world, including the US, are facing a decreased trust in government and in science. So I think that these are all factors that come together to drive people's behaviors. And the places where people are willing to follow the evidence-based scientific guidelines, they're finding success. They're finding that they're able to suppress the virus.
So it's important to believe in science in order to follow those guidelines.
Well, it's important to have guidelines that are based on science. I mean, there's when I trained in health policy, we use a model of health policy that says to be effective as a policy, it has to have three elements. The first is it has to be based in science. It has to be based in scientific evidence. The second is that it has to be socially acceptable, something that the public is willing to do. And the third is that it has to have political will to implement and enforce it. And I think that that's very true in this situation. If you have a policy where any one of those three pieces is missing, the policy will struggle. So, of course, these policies to work need to be based in science. They also have to be structured in a way that the public is willing to follow them and that the government is willing to enforce them.
Okay. Unfortunately, the number of infected and death toll in the United States from coronavirus is continue to rise rapidly, especially in the past several weeks. And some scientists forecast that there will be about 200,000 people to die in the United States by the end of this year, early next year. Do you think is this inevitable?
I don't know. I have no way to judge inevitability. The current trajectory for the virus, particularly in those places where it's not been well controlled, that 200,000 number is a possibility. I think that we've seen, as I said, other states where they've had good success. If we're able to flatten the curve in all of the states, we don't have to get to 200. I don't think it's a fully inevitable situation. But it really depends on the factors of what people do, and it depends on the virus. It depends on the mutations of the virus over the next few months. It depends on the relationship of the virus to the environment and whether cold weather affects the transmission. So there's still a few things that are going to be unknowns, and I think, you know, if anything, those models that suggest 200,000 deaths in the U.S. should just be motivation to focus on the science and to do what's necessary to stop transmission.
Okay, thank you. Let's move on and ask a few questions on current state of science about coronavirus and particularly about development. So Dr. Anthony Fauci mentioned that we should have a vaccine by the end of the year, and the production will be ramped up next year. And I've heard that Moderna now has developed successful vaccine, as well as the Oxford group, and I think the groups in Germany and many others. And whether the vaccine works and how long it may work, whether we may be protected for life or just for a few months, are those still open questions? Many people are concerned how strong the immune response to vaccine, and you think that vaccine that will be developed will be useful at all?
Yeah, there's so many vaccines in development right now. I struggle actually to keep track of them. There's many different vaccine technologies that are being used right now. There's protein-based vaccines and RNA-based vaccines. And there's actually some new technologies that are being tried to develop vaccines for coronavirus. So there's more than 150 and closer to 200 vaccines in development right now. There's only 2 that I know of that have reached phase 3 trials. As I'm sure you know, there's a 3-phase process for testing a vaccine. And then once the testing is completed, it goes to a certification process before it can be marketed and distributed. So most of the vaccines are in a preclinical or a pre-phase 1 stage of development. Many of them are phase 1 or 2, and only a couple of them are getting towards the end. The US Food and Drug Administration has announced that it would require a vaccine to be at least 50% protective, meaning that at least half the people who receive the vaccine would be protected from the coronavirus. And I think that that's a good benchmark. It's a reasonable target. You don't need a perfect vaccine. You need a vaccine that will protect many people. And if you're able to get that vaccine distributed and get doses out there, it will do quite a bit itself to suppress transmission. So if we're able to get a vaccine by the end of the year through the development cycle, then the next step is to get it manufactured in quantities and get it distributed. And I think that's going to be another big barrier. So people talk about, you know, the push to have a vaccine by the end of the year. I think that's very possible, but I think realistically, we won't be receiving it. We won't be able to get a vaccination until sometime in 2021, after they're able to scale up the vaccine and distribute it. In terms of its immunogenicity and how long it's protective for, we'll have to see. As I said, there's many different technologies out there being tested, and you know, it may be that the first vaccine out there, you know, has a limited duration, and later ones provide longer protection. That's fine. I think, you know, at this stage, we want to get any effective vaccine out to the public as soon as possible to help us, since it does not seem that herd immunity is going to be a way to stop this pandemic anytime soon.
So you're saying that there is a possibility that should I get vaccinated from coronavirus, there is a 50% of chance that I may or may not be protected from coronavirus should I meet infected person.
Well, what I was saying is that is the minimum that our Food and Drug Administration is willing to accept. So obviously, a vaccine that's 90 or 100% protective is much better. You know, normally
but
vaccines
it is acceptable, you're saying, right? 50%.
Right. Normally, vaccines are not 100% effective, meaning that there are some small number of people who are vaccinated who still can get sick because their body does not create antibodies to the vaccine because the vaccine doesn't work for everybody. Depending on their own health and their personal circumstances. So there's very few 100% effective vaccines, but most vaccines are in the range of 60, 70, 80, 90% effective. The cholera vaccine is somewhat less effective than that. There's different levels, but in a large scale epidemic, you don't need it to be very, very highly effective. You only need a portion of the people infected to be protected for it to really assist in getting ahead of the pandemic and flattening the curve of the pandemic and protecting the population. So the FDA has set a bottom in terms of acceptability, but obviously the higher the effectiveness, the better.
There was a lot of discussion about herd immunity, and I've heard different, percentages of population that needs to be protected from coronavirus. And one of the Harvard study mentioned that there should be 55% of population needs to be protected, but also I've heard about 70, even 90%. So what's your take on this?
There's a few groups that have tried to model this, and so herd immunity is, as you know, is the percent of the population that has already become immune, either because they were infected themselves or because they were vaccinated, to be able to stop the transmission of the virus. Yes. And that percent is different for different viruses. There's viruses like measles that are very, very transmissible, where you need a higher herd immunity, and others are less so. So the models around coronavirus have gone from, as you said, maybe 55% to 60, 70. I've seen some that are a little higher. I don't think we know for certain right now. What we do know is that there's no part of the world that's close to that right now. There was a study done in several cities after big waves, after the first waves of the pandemic, looking at some countries in Europe, looking at New York City, which had a very, very big outbreak early in the arrival in the United States. Even after so many cases in New York City, even after the hospitals were overflowing, it was still less than 20% of people who were immune. So they still were not close to herd immunity at that point. There was another study that came out, I think, just this week, looking at Spain, which we talked about, and saying that only 5% of people there had antibodies, which means that the vast, vast majority of that population still could get sick. And that's, I think, the challenge that we face, is that even though we feel overwhelmed, even though our hospitals are overwhelmed, we're not getting to a point where the pandemic will just die out by itself.
Okay. So my next question for you as a physician, not as a maybe epidemiologist. So should I get infected with coronavirus? God's sake, thanks God I'm not infected, and I recovered from coronavirus. Do you think I can go outside and not wearing masks? Am I protected or not? And for how long? What will be your recommendation?
Right, there's a lot of layers to your question, actually. Part of it is, is whether you're immune, whether you're protected from being infected the second time, and then the other part is whether you should wear a mask. I think that most of the scientists, who work in this area, we expect that people who have recovered will be immune for some period of time. There's data that shows that the antibodies that we create, humans do create antibodies against the virus, and those antibodies do wear off after a period of time. What's not known, and there's a lot of work going into figuring this out right now, is firstly, whether the antibodies that we create are themselves protective, or whether there's other factors that are required to protect us from reinfection. And secondly, as the measurable antibodies that we are testing for in people's blood decline, does that mean our immunity is declining also? The body creates many, many different kinds of antibodies in response to a virus. And when you're testing blood, you're looking for specific antibodies. So the relationship between what they're testing for in blood and what they and what's required for immunity is not clear at this point. And there's a lot of research going into identifying the specific antibodies that are the core elements of immunity for people who have been infected. So, with all of that uncertainty, my advice to the patients that I treat is that after you recover, you are probably immune. I call them bulletproof for some period of time, probably a month, 2 months, maybe longer, but we just don't know. I would still recommend to those people that they wear masks. And the reason is twofold. Even though that they can't get sick, and even though they've recovered and they should not be spreading virus at that point because their body has recovered, if you are known as somebody who is sick, people around you are nervous. Even though you've recovered, even though you may be the actual safest person in the community because you've recovered and you can't get sick again, people still have the concern around somebody who had coronavirus, the stigma of it. And I think that, it's good to wear a mask to reassure people around you. It's also good to set a good example. And I think, part of the challenge we face is that everybody says they're not sick. Everybody says they're the healthiest person in their community. And by that logic, nobody would wear a mask. The reality is that that's not true for everyone. And therefore we should all wear a mask. And I would tell anybody, even if they've recovered, if you're going in public, if you're going to the supermarket, wear a mask. It's the thing to do right now if you're part of a society that is fighting this pandemic, and your personal immune status isn't really the issue.
Thank you very much. This is very good advice. I will convey that to some of the patients who are asking me the same very question. So there is a study recently completed in Italy and Spain that demonstrated that people with blood type A2 are more often infected and suffer from coronaviruses, severely suffer from coronavirus than people with other types of blood. So what do you think about this?
I did read a couple of studies. There's been a few studies about blood type and COVID-19. One that I'm aware of, which I think came from China, showed that people with blood type A were more likely to be infected. But that paper is still under scientific review. It hasn't been officially released because it's still being reviewed by other scientists. There was this other study that I think was published in the New England Journal that looked at people with blood type A and showed that among those who had very severe disease, who were hospitalized, who were in the intensive care unit, they were more likely to be type A blood. Because of this, there's still some additional factors that need to be figured out in my mind. There's still some additional science to understand whether having type A blood is a risk of infection, or whether the risk is that once you're infected, if you have type A, you are more likely to get severe disease. And those are slightly different questions, and I don't think the papers that are out there clearly answer that. That said, I don't think it's not surprising to me that there is an association between blood type and the severity of disease. Our blood type is determined by proteins that are closely linked to our immune system, and there are associations between blood type and other diseases. So it's not that surprising. To me, it's also not a critical question because you can't change your blood type. There's nothing that you can really take from these articles that are going to help you as an individual to protect yourself. It might have implications for how we manage groups of patients, but I think these are interesting articles, but they're not the ones that we need to help people make the right choices for themselves.
Yeah, but of course, if somebody determined that the patient has type A blood, then the doctor in the hospital needs to be more vigilant about potential severe symptoms in that patient. Should that be confirmed, the data that they are more prone to develop severe disease? But anyways, yeah, I understand that there's still research in development. We don't know for sure, and this may change, especially since, as you mentioned, viruses keep mutating, and nobody knows what will be the next situation with the susceptibility to this virus. Um, uh, how about Remdesivir? I remember about a month ago, there's a lot of excitement, and Dr. Fauci actually mentioned that there's a real breakthrough. But I looked at the clinical trials, and there are actually two reports on Remdesivir. One was published in Lancet, another one in, I think it's the New England Journal of Medicine, that described the results of this clinical trials. That actually Dr. Fauci mentioned that Remdesivir reduces the length of stay of patients with coronavirus by 30%. Um, uh, and I remember, like, there was a a lot of discussion about Tamiflu during this swine virus and us, and actually they mentioned that Tamiflu, yeah, generally it's a useless drug, but like it reduces the severity of disease, and it reduces the length of stay in the hospital. So do you think this this understanding of how Remdesivir works, is it sufficient to use this expensive drug for treatment of coronavirus? I mean, on different story, for instance, I am very excited that dexamethasone is very, very effective in reducing severity of disease, and it's a cheap drug and widely used in clinical practice. But with the remdesivir, it's quite expensive, and I see that I was not really impressed by what they reported in the clinical trial, like, articles. What's your take on this?
So I did read the articles, and I'm aware that remdesivir is somewhat effective. It's not a miracle drug at all, but we're also at a phase in the pandemic where we need everything we can get to fight this virus. So I think that it's clear that it does shorten hospital stay. It's clear that it has some benefit for patients, but every country, every hospital, and every person needs to balance the benefit of a drug versus its cost. And remdesivir is expensive. It's also not as available as potentially we would like it to be. So these are the factors that I think everybody is struggling with right now. Remdesivir and dexamethasone, the two drugs that you mentioned, are currently the only drugs that are approved in the United States for treating the coronavirus, for COVID-19. There's a lot of other drugs that are used in other places, and as much as I want there to be additional treatments available, I'm also very concerned that many countries are using drugs which are simply not effective. It uses money, it uses resources, and it takes time to use these drugs. And if they're not effective, then those are resources that would be better put somewhere else. So I think that countries need to look at their clinical guidelines and look at the recent science, look at the recommendations coming from the World Health Organization, and they need to consider revising guidelines and educating doctors about which drugs are useful and which ones are not, because there are certainly instances, including here in Central Asia, where people are wasting time and wasting money on things that are not effective. So, I'm hopeful over time we'll get more drugs and more different options that the science shows are truly effective.
Yeah, you're probably talking about hydroxychloroquine, or like lopinavir and ritonavir. Those clinical studies show that they are not effective, and hydroxychloroquine especially could be detrimental to like heart rhythm and so forth. So I assume that this is not that what you recommend to use for patients in Kazakhstan, but still it's in the clinical protocols. So are you participating in developing clinical protocols? Are you advising? I'm talking about CDC, Regional Office for Central Asia. How are you involved in advising, in particular, this area of collaboration with Kazakhstan?
So we have a number of scientists in my office, Kazakhstani epidemiologists and doctors. And we do review each time the clinical guidelines are reissued, we do review them, and we will make recommendations to the government. But we also have to be respectful that the government has its own experts, and they have the ability to analyze the research themselves and make the decisions that they think are appropriate for this country. So we don't sit on the committee. We would be willing to if we were invited to, but at this point, that's not the way that we've operated. We've waited until guidelines are released, and then we provide some comments back to the government about what we think would work or not. You mentioned hydroxychloroquine. You mentioned the HIV drugs. The WHO recently recommended that those not be used. So we'll see whether the guidelines in Kazakhstan are updated to reflect that or not. I'm worried about those. I'm also worried about the overuse of antibiotics, which are obviously not effective against the virus. So I think there's lots of opportunities for improvement, and I think that each time the government revises its guidelines, it's making some improvements. But there's more to be done, and my office here in Almaty, we're very ready to assist the government in any way that they would find helpful.
Yeah. Yeah, I agree. Well, still, I don't understand the perseverance of President Trump to promote hydroxychloroquine. Although it's already clear by medical evidence that it's useless, even a detrimental drug. On a different topic about convalescent plasma, which is plasma, the fraction of blood that could be taken from a patient who recovered from COVID-19. And there's a lot of excitement about using these, and some companies recently developed even cocktails of immunoglobulins, and that's successfully been treated in some patients. But at current stage, the convalescent plasma has its limits, because one survival can only help to treat no more than 3 other patients. So how do you think technology can be used and improved so that those who survived COVID-19 can help others to get treated or to be protected from coronavirus?
So convalescent plasma is an interesting thing, and on one hand, it's a very well-established science, right? Convalescent plasma has been used for many years to treat other types of infectious diseases. On the other hand, as you said, it's expensive to do it. It's a limited resource, and it's not very well suited to doing across large populations. So that's the struggle. I think in the short term, it could be possible to work through blood banks to scale operations for convalescent plasma to make it available to the sickest patients, across the whole health system. But that would require major reorganizations within the health system, including logistics, transportation, the ability to prioritize patients, and deliver the plasma to wherever it's needed. And those kinds of changes are very, very hard to do in the middle of a crisis. Longer term, there are groups that are working on monoclonal antibodies, and you mentioned these cocktails of antibodies. Those are not dependent on plasma. It's a similar idea. It's using directed antibodies to help people, but they're created in a laboratory. They can be manufactured at an industrial scale, and the hard part of the science is really understanding which antibodies are the right ones to fight the virus and how to produce them. There's at least one company I'm aware of that's in a phase 3 trial for a monoclonal antibody cocktail for COVID. So those could be coming to market soon. But just like with vaccines, once it's done, it then has to be available at a reasonable cost, and it has to be manufactured, at a scale where it can be distributed widely. So I think, in the interim, clearly patients who are mild or moderate cases of COVID should not get convalescent serum. They will generally recover without it. It can be helpful for very sick patients, but the system needs close management to make sure that plasma is available to people.
Thank you. And I have last hypothetical questions, Dr. Singer. So I'm not sure whether you're a fan of football or baseball or basketball, but my question is, When do you think Americans again be able to go to football or baseball matches?
Oh, you have all the big questions. Americans love our sports, and I've been wanting to go to sporting events here in Almaty and haven't been able to. I think in the near future, I think it will be possible to host competitions, but only for television, without a live audience. That in itself is a challenge. It requires testing all of the players and all of the coaches ahead of the game. There's places where we are doing that in America, and it's important to do it because we're finding that there are oftentimes players who are asymptomatic and infected, and only through this pre-game testing are they being detected and prevented from spreading the disease to others. So I think that's in the near term a more likely way that we'll be able to enjoy sports is through the television. Personally, looking at the situation in my country and also the situation here in Kazakhstan, I don't think it's safe right now to open large sporting events to the public. I don't think that any large gatherings are appropriate at this phase when the pandemic is still spreading widely. We can survive with televised sports for a while. And hopefully, within the next season or sometime soon, we'll actually be able to support our teams in person.
Yeah, the same way as we enjoyed watching Hamilton Broadway show on TV on Disney Plus. Unfortunately, I didn't have opportunity to actually go to the actual show, but what I saw on the screen was quite impressive. So probably that's that's new normal. Unfortunately.
Yes, I was lucky. I did see Hamilton in Broadway before I came to Kazakhstan. My plan for this spring was I wanted to go to Shymkent and I wanted to see Kokpa, but the pandemic happened and things changed. So I'm going to have to delay my first experience with Kokpa until sometime in the future.
Okay, that's hopefully you enjoy that tradition. So my last question is, if you were asked to write something on the billboard of Almaty's Dostik Street, which I assume you know where it is, not far from your office actually, what words would you use to help Almaty residents avoid being infected with coronavirus?
I think the government's been doing quite a bit to inform residents. What I would tell people is that staying at home and wearing a mask when they do go out of their home, that's how they show love for their country, and that's how they show love for each other. I think that people need to understand them, and I think that Kazakhstanis do understand about responsibility and sacrifice. And that's clear to me whenever you visit the memorials around Almaty to those who've fallen in various wars. So people in this country do understand what it means to be facing a challenge, and this battle that we're having now against this virus is as serious as any of the others. The number of people who end up dying from this virus could be very comparable to a war. So I think people need to approach it with that mindset and understand that the things that the government is asking of them are the way that they show their patriotism and their love for each other.
Okay. Thank you so much, Dr. Singer. So if you remind my concluding remarks, such experts as Dr. Daniel Singer have been clear as what needs to be done to end this pandemic. In absence of vaccines, the world is dealing with the same resources as far as drugs and other treatments. We need to do more testing, more contact tracing. We need to be more diligent about social distancing and wearing masks. There is a hope if you look around the globe to countries like Taiwan and New Zealand. They show us that defeating the virus is possible. And we also have the world's top scientists working at record pace to develop a vaccine. But we cannot wait until then. The government and all of us need to listen to the experts. We need to look at the data and we need to correct the mistakes that have already been made. It's not too late to save some lives. Thank you so much for your time, Dr. Singer. Hopefully, when you return from the United States, from your R&R or from your vacation, whatever it is, I hope to meet you in person and maybe have a cup of coffee, probably outside, not inside the cafe, but outside. Hopefully, we'll not be wearing masks at that time, but keep social distance. But I'll be happy. I'll be thrilled to have more conversations when you return. I'm sure that you have a lot more knowledge about that, and I would appreciate if you share that knowledge with me and with other people. Thank you so much. Have a nice day.
Thank you.
And enjoy your travel back to the United States with your family.
I'll be back here soon, and I hope the situation will be improved so that we could actually sit together. That would be wonderful.
Okay, stay well. Thank you.
Thank you.